Hey, good morning, Dr. Karan here. I wanted to put this video. This is about elevated liver enzyme, and we see it very often that people come had some general testing done, and they have elevated liver enzymes. Usually seen in the middle-aged male or female, and usually have a high BMI of 25, 30 or plus, and they have also evidence of prediabetes. And so, how I approach this kind of patient with a high liver enzyme, I want to discuss that. So, metabolic associated fatty liver disease, or called steatotic liver disease, they're strongly associated with obesity, insulin resistance, and metabolic syndrome. So, what happens is that initially there's an accumulation of fat called simple steatosis, and that causes inflammation of the liver cells called steatohepatitis, or MASH, and that leads to scarring and fibrosis and can lead to cirrhosis. So, what are the different things can be the causes? Alcohol is one of the thing. Alcohol related liver disease. Anybody who has alcohol uses of more than 21 drinks per week, they're high risk. Usually AST enzyme is more than ALT enzyme. People with the viral hepatitis, like chronic hepatitis C infection, we see that often, or hepatitis B as well. Somebody could have a problem with excess deposition of iron, and that in the liver, that can cause elevated liver enzyme. And I remember a patient which I saw several years ago, and patient was quite healthy though, and but with my history, I found out that patient is have been using iron skillet for cooking for many years, and his iron level was very high. So that was the reason for his elevated liver enzyme. Sometimes it could be autoimmune hepatitis, and you got to check it for ANA and lupus and things like that. Wilson's disease is another rare problem. It could be because of the copper issues in the liver. Drug-induced liver injury because of excessive use of Tylenol or a statin or other medication. Some supplement can cause it as well. Thyroid disease can cause elevated AST and ALT enzyme, and so thyroid profile have to be checked. Celiac disease can cause elevation in the liver enzymes, like gastrointestinal issues. So we check a patient for anti-TGA antibodies. What are the labs I usually order? I order liver panel, which is AST, ALT, GGT, ALP, and bilirubin. We check for A1C, fasting glucose, and fasting insulin, and also lipid panel, iron, ferritin, thyroid, TSH, and free T4. And we do viral panel for hepatitis B surface antigen and anti-HCV antibodies, which is hepatitis C antibody. And we do autoimmune screening for ANA, ASMA, and IgG. And a patient is younger, less than 40, then we also check ceruloplasmin to check the copper status in the body. And then we check patient's liver function by check platelets and albumin and ProTime and INR. I also order abdominal ultrasound to check for a patient has enlargement of the liver or fatty liver. If there's a concern for fibrosis, then we order fibroscan or MR elastography. So, how do you manage? Our main goal is to reverse liver fat and inflammation and prevent fibrosis and control metabolic factors. So, weight loss is number one. Goal is to reduce 10% of body weight. Exercise at least 150 minutes per week. Regular walking is good if you cannot go to gym. Good diet, Mediterranean diet, low refined carb, high protein diet, and staying away from trans fat and sugary food and sugary drink, and limiting your alcohol less than 2 drinks per week. is a great idea. And make sure you sleep well and you reduce your stress. If sometime patient need treatment as well. Suppose somebody has pre-diabetes, we can start metformin, or obesity is an issue. So along with the dietary modification, we can start patient on GLP-1, Wegovy, Ozempic, Monjaro, etc. And fix and help them with the correcting their high cholesterol issue with the statin. And vitamin E supplement is a very good idea. And then we follow up liver enzymes every 6 months, and annually we check ultrasound if needed. And prevention strategy is to maintain your BMI close to 25, avoid sugary beverages and processed carb, screen for diabetes and hypertension annually, and moderation of alcohol intake. And if you quit alcohol intake completely, that's great. So this is the summary. Your liver is showing signs of fat buildup, likely related to weight and pre-diabetes. And this is totally reversible with weight loss and lifestyle changes. So with the help of your doctor, you can monitor yourself and enjoy good health. Thank you for watching. Have a great Tuesday.